Hi everybody, today's video is about the dreaded tummy bug. So we see children all the time for viral gastroenteritis, which means that they have an infection that's irritating their stomach and the lining of their gut. And this is what I think as parents we all dread the most, the vomiting and diarrhea bug. So I just want to teach you some quick tricks about it. Most of the time, it only lasts about 24 hours. So most of the time, this is the sort of thing you can manage at home. Those are the tricks I want to teach you. Remember, as always, this is just general medical information and advice from me to you as parents. It does not apply specifically to every child, and always you should ask your own pediatrician for specific questions or situations. So let me tell you, most important thing is prevention. So this is disgusting. Brace yourself. The way the dreaded tummy bug is transmitted is fecal oral. So fecal, poop, stool, somehow those viral particles from poop have to get into your child's mouth. And that sounds impossible, but it's not. And it's not impossible for you to catch it from them either, unfortunately. Imagine you're changing a diarrhea diaper and there are viral particles everywhere because there's poop everywhere. It's very easy for one of those viral particles to get underneath your fingernail. If you are not washing your hands carefully and then you eat a snack, it made it from fecal oral and you have that same infection. So you have to scrub your hands after handling any of their bodily fluids, particularly stool is where most of it comes from though. So careful hand washing, Lysol countertops. This is actually one of those times when plain old hand sanitizer isn't good enough. We need running water, warm water with soap for at least 20 seconds to help prevent transmission of this virus. Remember too, there are some vaccines that can help with the stomach bug. For example, the hepatitis A vaccine is a series of 2 that have to be 6 to 12 months apart that can protect you and your children from the hepatitis A virus that causes a lot of vomiting and diarrhea, and that virus is born mostly in food and water. So that's one way to protect. Also, when your children are infants, as babies, they get a rotavirus vaccine at 2, 4, and 6 months. That's an oral live virus vaccine, which obviously we recommend because rotavirus used to be the #1 cause for hospital admissions for IV fluids in dehydrated babies from viral gastroenteritis. But now that the vaccine's out, that's no longer as big of a player. So prevention is vaccinate when possible, careful hand washing, and even isolating. If you have enough bathrooms in your house that one of your children who has the tummy bug can use one bathroom and the other children can use the other, that would be a great idea. So prevention's important. The next step is the biggest thing we're worried about is dehydration. So it's important for you guys to monitor your children's urine output. Now in an infant that's easy because they're in a diaper and you can just count the number of pee diapers. Even then sometimes it's hard though because they're having so many liquidy stool diapers that you can't tell if the diaper has urine in it or not. So some parents will put a Kleenex or something in the front of the diaper to see if there's actually pee output. So we want to have at least 1 urine diaper or 1 urine output, or using the potty in older kids, every 8 hours or 3 every 24 hours. That's an important way to monitor. Also for younger infants, you can make sure that their mouth is moist and wet, that there's adequate saliva in there. That's important. And probably the most important thing through all of this is making sure they're hydrated, because if they're not hydrated, they may need IV fluids. Now remember, even with ongoing vomiting and diarrhea, you still can orally rehydrate, meaning that you can still get some hydration going on even though they're losing some both ways. Now the fluids we would recommend are just clear fluids. So if your baby is still breastfeeding, you can continue to breastfeed. There are antibodies in the breast milk that will help the baby fight this off, and that's valuable. Otherwise, it's generally important and recommended to steer clear of dairy products and just encourage clear fluids like in infants, Pedialyte, or in older children, Gatorade. And even in infants, if you can't get your hands on some Pedialyte, like in the middle of the night, you could always just do dilute Gatorade, half water and half Gatorade, and that's totally fine. Now, the other trick is you want to get in little tiny sips at a time. So that child may want to just gulp down a jug of Gatorade right after they threw up. Don't do that. Make them wait 15 to 30 minutes to let the tummy settle a minute because it's so busy churning and throwing up. Let it calm down. And then just put in a little sip of clear fluids, slowly, slowly. That's why popsicles are so handy, because they can only get a little bit of fluid at a time and not just gulp down a whole popsicle. So clear liquids only, small amounts at a time. Now, after throwing up, wait the 15 to 30 minutes, but also wait at least 12 hours from the last episode of vomiting before you start reintroducing solid foods. And as you reintroduce solid foods, same principle as the fluids, little tiny sips at a time and little tiny snacks of solid foods at a time. So lean protein is okay, a little bite of banana that has potassium in it to help make up for the lost potassium in the diarrhea, a little bit of applesauce, a piece of toast. So gentle, bland, protein's okay, some plain carbs are okay. Let me just tell you one quick trick too. For some reason, this idea has persisted that Coke or Pepsi are a great trick for the stomach bug. Nothing could be farther from the truth. The stools are already very fluidy, and the high fructose corn syrup in sodas just bring more water into the stool and make them more liquidy. And the caffeine in the sodas make you have more peristalsis, and you have just more diarrhea. And the carbonation in the sodas make you burp and throw up more. So sodas are absolutely a horrible choice. We don't even recommend fruit juices at this point, or things that are high in sugar content. So really just clear liquids, popsicles, Jell-O, Gatorade, and things like that. Ice chips are fine. Plain water, totally fine. So careful hand washing, monitor urine output, clear liquids only, bland starchy solids. Once the stools are formed, if it's an infant, they're allowed to return to daycare, but should not return to daycare when the stools are still liquidy, because there's a little bit of public health concern with this too, both trying to limit its spread within your house, but to the friends of your children as well. So the tummy bug is horrendous, but normally it only lasts for about 24 hours, thank goodness. And if you ever see blood in the stool, mucus in the stool, or if the vomiting and diarrhea is accompanied by very high fever, you definitely need to be seen by your pediatrician and call in. If you're concerned at all, for any reason, call your pediatrician for specific advice about your baby. We worry also with vomiting only in older children that it could be strep, especially if there's some fever and never any diarrhea. And of course, we have to worry about appendicitis, especially if they have significant abdominal pain in the right lower quadrant. So I certainly hope you guys do not suffer from this during this winter season when we've been seeing a lot of it. But if so, I hope these quick tips will be helpful. Thanks.